All right, welcome back to the Pure Playbook. I'm Dr. Dustin Bosson here with the Dr. Nate Merhaut. Fresh off really the start of some big tournaments in summer sports for student athletes. So here we go, another episode, just bringing more relevant information for student athletes and their parents trying to keep up, as our whole goal, mission, effort, everything that we do here is to protect and build student athletes better. Today's topic, we are going to talk about
cracking open a cold one.
Cracking open a cold one. Yeah, grab your red Solo cups, parents, and join us for this one, as we are going to start talking about warm-up routines, the myths, the changing research.
Different kind of pregame.
The different kind of pregame. Yeah, so here's how you student athletes should be pre-gaming before the game. While your parents have their red Solo cups and they're cracking cold ones, you should be doing these kinds of warm-ups. And so let's jump into that, because we are, as we're recording this right now, we're at the beginning of June, which across the nation is big in soccer. Baseball starting up, but we've got State Cup soccer going on, and we've been on the field for multiple athletes. Our athletes were actually... of the 8 we had just Saturday, Sunday, they were undefeated, which was pretty cool. So there's plenty of teams out there, but that was pretty cool to be able to connect with the parents. But as we're going through that, we do talk a lot about the pregame and everything from pregame all the way through recovery. What does injury prevention look like? What should we be doing? And we're getting a lot of these questions asked too, but the status quo of if you're doing your dad's 1980s routine,
right,
that needs to change. There's going to be some things we talk about that you're going to remove from your bag, and you're going to remove from your kids' bags for good, hopefully. But we're going to talk about a bunch of different things, dynamically, statically, the do's, the don'ts, what you should eat, what you should drink. We'll touch a little bit on that too. But just walking through the sidelines and seeing some of the things, or as they're prepping to go into the game, there's a lot of things that we need to talk about when we are begging for injury prevention and limiting catastrophic injuries and things like that. So listen up as we go through this. Where do you want to start?
Where I want to start is what we're kind of getting at is your warm-up should consist of a dynamic warm-up, not a static warm-up. Thanks for listening to the Pure Playbook. Next week, we're going to be... No, basically, I mean, that's everybody knows that, I feel like, and it's something that we say ad nauseum, but we were at the game yesterday and we saw these kids warming up to get in after they've been sitting on the bench for 10, 15, 20 minutes going into the first half, and they're static stretching going in before. And
so real quick, let's go over the two different types of stretching and just give us our 30-second synopsis of what each is.
So there's the dynamic stretching and the static stretching. Static stretching is going to be something as simple as bending down and touching your toes and holding for 10, 15, 20, 30 seconds. You're standing,
hugging yourself.
You're standing in a circle and everybody's going down, going 1, 2, 3. Everybody's counting, that kind of thing. Very old school. We can get into the bouncing, no bouncing kind of conversation, because that's a myth too that we can discuss. The other one opposed from static is going to be opposite of static is going to be the dynamic stretching. So dynamic simply is you're moving and feeling a stretch at the same time. And it can also be a little bit more sports specific when we're getting into dynamic movements, and we can talk about progressions and what's appropriate within a dynamic warm-up and when you should do certain things within a dynamic warm-up, because that can be a little bit more complex than just saying do a dynamic warm-up versus do a static warm-up or a static stretch. And the biggest thing overall with why we're saying do a dynamic warm-up versus a static stretch prior to working out, prior to competition, prior to practice, is more so it helps with increasing performance. That's the big thing. There's debate on if it's going to decrease susceptibility to injury and injury risk and those things. There's some physiology and biomechanics we can get into on potentially why that would be the case, on why dynamic warm-up would be better from an injury prevention standpoint.
If you want us to do a podcast on sacromeres and Golgi tendon apparatuses and things like that, you let us know. We'll spare you that part.
Crickets. But the dynamic warm-up is really where we want to go with this. And so we're not going to talk too much on the static side of things, because if anything, it can be used and peppered in here and there, but it's not solely what you're going to do. And when we're seeing kids across the field on the bench sitting there doing static stretching as they're about to go in, not necessarily the best scenario for them.
And there's research out there. Let's just put this right off the bat before we even talk about injuries or anything else. There's research that I'm literally looking at right here that shows the decrease in, like you were saying, it decreases performance. Static stretching will decrease performance for at least 30 minutes.
Mm-hmm.
Like they basically stopped at 30 minutes.
Yeah.
So if you're talking about jumping, running, sprinting, if we're not playing pool or doing something more static, then the dynamic stretch is really what you need. There is time for static stretching. I'll hit on that a little bit later, but think right now that your dynamic warm up is for performance. Your static is going to be more for cool down, and we'll touch on that a little bit here towards the end.
Let me take it one step further into dynamic warm ups, and this is something that Dr. Dustin wasn't planning on me talking about, but it is something that I'm passionate about. If you know me and have been in the office, you know I'm passionate about it. The difference between static stretching, and there's a research article out there, I don't have it off the top of my head, but there's a research article out there that tested static stretching versus dynamic stretching versus dynamic stretching with bands. And what they did with this study was they had 3 groups do each of those forms of warm-up, and then they came back 30 minutes later and retested. Basically, it was a sit and reach was the test and retest. So the sit and reach is something that a lot of people have done, and probably a lot of parents remember doing this in gym class at some point as a fitness test to see how flexible you guys are. And it shows, in a sense, hamstring, posterior chain, low back flexibility, hip flexibility. So they tested and retested those 3 groups. And after that 30-minute mark, can you guess which group did the best? And it was the group that did the dynamic stretching with the bands. And so what that basically says is doing dynamic stretching versus static stretching is going to hold longer. So from a performance standpoint, even after sitting on the bench for a period of time, it's still going to have an effect to what the study showed was about 30 minutes afterwards, holding that mobility and keeping those muscles warm versus the static stretch. The static stretching group went right back to where their initial test was. So there really wasn't much change except for after the initial static stretching period. When they retested right after they stretched, there was improvement, but there was not sustained improvement. The dynamic stretching had sustained improvement, but not as good as the dynamic stretching with the bands. So taking that piece of information and that research study, we're implementing it in our office, and a lot of the stuff that we're giving to our athletes as a dynamic warm-up includes banded exercises.
So, and let me just say this is we're talking like, if you want to cut down time of a warm-up, and jury thinks it's still out, but I'm just going to boldly say, if you're going to cut time down on a warm-up, if you're going to increase injury prevention, if you are going to increase endurance and longevity, if you're going to keep a high amount of power and performance, dynamic stretching is 99% of the time the way you're going to want to go. So take a 15-minute, like, gather around the circle. Okay, right leg, left leg, straight down, spread your legs, straight down, right leg. It's like, okay. Dynamic warm-ups can cut down time, increase performance, and injury susceptibility. And honestly, I think there's a couple different reasons why either people don't know this, don't do this, or why kids don't actively do this. And so there's a few different reasons. So let me roll through those real quick. One is, we have, maybe some teams don't have proper education on what to do, how to do it, where do we go, who do we trust, how do we prevent. They don't have those. They just don't have that knowledge. So they do the best they can with what they know. And it's like, okay, well, some stretching is better than no stretching. Get around the circle, do the thing.
Right.
Hug yourself, stretch your legs, whatever. Okay, great. The other thing is maybe there's a little pride factor, and this is how we do it, and that's how I want it done. And then, okay, so there's number 2. Number 3 could be, we're just damn lazy. And so that's either, it could be from a coaching perspective. Well, I don't really want to look into all that stuff. It's like, okay, that could be it. I'm going to not even go down that road. Doesn't really matter. We know who we are. You know who you are if you're in that. Please change that. But more importantly, these kids nowadays, what do they want to do? They want to jump on the field. They want to play. They want to talk about their little girlfriends with their buddies. They want to talk about their boyfriends with the girls. And it's like, okay, yeah, and now you're just not paying attention to what you're doing. So let's not be dummies, okay? And let's take just 7 minutes at a time. Like if you could do 7 minutes, if we gave you exactly what you needed to do, you could knock it out 7 minutes and be ready to play. So let's just not be lazy and dumb about it.
Yeah.
Put in the time. And if you're coming off of the bench, same thing. It's like you even watch the FIFA stuff and these guys are running up and down and it takes them, 14, 15 minutes to even get in the game and they're already warming up. Cool. No problem with that. But I'm just saying most people want to do a few things. They want to cut down time. They want to save more money and they want to increase performance on whatever it is in life.
Yeah.
So take it, run with it. Learn how to do it, ask the questions, do dynamic warm-ups.
My next book after breathing is going to be Dynamic Warm-Ups for Dummies. So keep an eye out for it. It'll be my next book. But what do you want to say?
TM.
Okay.
TM.
Dynamic Warm-Ups for Dummies. But as he was throwing off some of the things that why we want to do dynamic warming, I have a whole list right here of some research studies and what dynamic warm-ups are going to do for you. This is going to be a little bit more in detail and in depth than what he just mentioned, but let me shoot off a couple of these because then you'll see the depth of why we're doing this and the benefit of doing it. So some of these show that dynamic warm-ups are going to increase joint proprioception. What is that going to do for us? I had just asked one of our young athletes the other day, because I said throughout the word proprioception, I'm like, wait a minute, do you even know what proprioception means? And she's like, no. Okay, so let me explain this to you.
So when you start to sweat?
What does proprioception? That's perspiration.
Oh, okay.
But yeah, you can perspirate while you're propriocepting. So proprioception, simply put to a young athlete, is the way I described it is if you have your eyes closed and you point your toe down towards the floor, you know that you're pointing your toe down towards the floor, even when your eyes are closed, because there are little receptors and we call them little guys that are sending signals up to your brain, telling you where your joints are in space. In space meaning just where you are. So not outer space, in space. So proprioception in outer space is going to be a little different.
Yeah, you want to go to outer space, talk to Elon.
Yeah. So literally it's telling your brain where you are. So that's important because when you're playing sports, you're not looking at your feet, your knees, your hips all the time. You're not looking at where your shoulder is, your elbow is when you're throwing a ball. So your brain knows where your body is in space because those proprioceptors are telling it where it is as it's moving. When there's damage to a joint, when there's damage to a tendon, to the Golgi tendon, like we were talking about earlier, when there's damage to those soft tissues, it screws up that signal. So then you don't really know where that is anymore. So one of the things we have to do is retrain the proprioception. So if you ever sprain your ankle and someone told you to stand on one leg, close your eyes, blah, 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 stand on a Bosu ball or a foam pad, that's what they're retraining. So that it's a neurologic reset so that your body now knows where that joint is again because it was damaged. So dynamic warm-ups increase joint proprioception. So not only from an injury prevention standpoint, it's also going to be from a performance standpoint, help you perform better because now your body knows where it is after you did this dynamic warm-up. So that's one. Coordination, balance, muscle activation are all included in this research study. Another one is dynamic warm-ups can reduce compensatory movement patterns, which again, one thing, if you're not moving the right way, and we just talked about this the other day, something simple that I'll go on a rant on is if you don't know how to run correctly, that's already setting you up for failure. So one of the things we're also incorporating with a lot of our athletes is teaching them how to run. Something as simple as how do your arms move when you're supposed to run? And I'm going to go off on a little tangent on if you're crossing midline with your arms when you're running, your upper body is twisting and rotating. What do you think your lower body has to do to compensate for that upper body twisting? One, if you had a video camera above yourself looking down like a little a drone looking down, you're not running in a straight line if you're going side to side with your arms. You're actually going zigzag side to side. So you're losing energy, which, by the time you get fatigued at the end of the game, that's also increasing susceptibility to injuries. And then it's putting torque within different joints. So the knee's getting constantly torqued. The ankle and the hips are constantly getting that torque put through them. So those tissues over time, if they're getting that stress and strain that they shouldn't normally be getting, then they're eventually going to break down, especially if we're not doing recovery or if we're not doing proper dynamic warm-up, which helps reduce the compensatory movement pattern. So full circle right there. Another one Injured tissues can benefit from increased blood flow and elasticity. So if we're dealing with an overuse injury, and that's one thing that a lot of our athletes do deal with, is we need more blood flow to help with them heal, as well as help them perform even when they're at a deficit. So yes, there's a game we play with. Can an athlete play on an injury? Yes, they can sometimes. To what extent? What do they need to do prior to the game and prior to practices to set them up for success and not a re-injury scenario, or set them back, 2 steps or 3 steps versus, maybe a half step back? Because that's real life. And what we do with sports is sometimes there is that little bit of a setback if we're playing with an injury.
Yeah.
But by implementing dynamic warm-ups, and sometimes that's modified when you are injured, and that's something we could talk about, another podcast, but modifying that dynamic warm-up when you're injured to allow you to still do what you need to do in a game. That's something that the research also is showing. And then one last thing I'll throw out is the dynamic warm-ups that are more sports specific and controllable help the athlete regain the confidence of the injured area or of the area that they need to perform well with. So whether it's a baseball pitcher that needs to do a dynamic warm-up for their shoulder, that they can have the confidence that they can actually do that, versus doing something static and they're not even warmed up for the whole game that they might be playing. If you're Paul Skeens and his warm-up, that's a couple hours long.
Yeah.
So look at some of these professionals and some of their warm-ups, and some of them that are competing at such a high level, and see what they're doing and see what we're talking about, and incorporate some of that stuff into your own routine.
And the reason we want to talk about this, and you brought up, people like Paul Skeens, and looking at some of these athletes that are professionals, and you look at their warm-ups, there's plenty of them out there too being dummies and slacking during
I'll
their
give my book.
Yeah. However, for the most part, they have their pregame routine dialed, and you will see that more often. Like, how quick are these NFL guys out on the field before game time? Like, how much time do they have for that, and what are they doing? The dynamic, some of the dynamic exercises and things that you should be doing, like there could be a blanket, like here's the team routine. But I would take, most times in youth sports, it's 45 minutes to an hour. You get to the field beforehand, and okay, well, now we're lollygagging, and we're talking to our friends, and we're there an hour before the game, and now there's 35 minutes. Finally got your cleats on. It's like, no. Like, you are after it 45 minutes to an hour beforehand. So just to give an example, what does some of this look like? Is it's like, it is a brisk walk around the facility. Like, even at the soccer parks, walk around the soccer park, like, guys, take off, grab it, take off. And you are actively doing something. You're not just statically stretching. It's like taking a piece of string cheese, and it's like, okay,
yummy,
stretch. And it's like, okay, is there any micro tearing? You can get down into the microbiology level of this and probably look into that. But it's like, take a piece of string cheese, and it's like, okay, well, let's heat that string cheese up a little bit. And now you've got that beautiful cheese. Like, I picture a piece of pizza. Like, you take it out of the box, and it's like, and you know what? The performance of that pizza is great at that point.
It's not hungry.
It's not cold. It's not just breaking apart. It's like, you've got a great quality
piece of cheese
right there. But it really is the same with the body. It is like, you want to warm those up. You don't want to just take all the Golgi tendons and the sacromeres, and that's how you start to lose the performance, is because the overlaps of how these muscles work, like, they're all stitched together much like this, really. And it's like, what are you going to do? Just tear apart? There's no dynamic. If there's no dynamic warm up, you're not going to get the most performance out of it, and it's going to cost you. So take a lap. You see some people just hopping around and, I'm doing dynamic, and they're doing, internal, external hip rotation stuff. And it's like, that's better. You're getting better. However, each individual should also have their own, depending on what they are going through. What position do they play? Do they have any injuries? Are they coming off an injury? Is there more susceptibility? What's their body mass? What is their habitus as a whole? What is their flexibility, mobility? What's the demand?
What's their structure look like?
What's their structure look like? What's the demand on them? What position are they playing? What are they demanded to do during that? And so the warm up of what I was getting at, of that 60 to 45 minutes, is it's like, here's the blanket. That's where you start. and now I'll break up and do your own things that you know you should be doing.
Yeah.
But I think a lot of programs, especially at the student athlete level, they might not have that resource where it's like, what should Evie be doing? What should Simone be doing? What should Bree be doing? What should Soph be doing? And you can go down the line, and it's like, that's truly what you need for the best opportunity for warm-ups and prevention. Do not just sit there and statically stretch and bend over, grab your toes. And you athletes that might be listening, please take it seriously. Your performance depends on it. If you want to get an extra 10% over everybody else, dynamic warm-up, do it religiously, be focused when you do it, knock it out, and you will thank yourself on multiple fronts.
One of the other things I like to tell athletes is if you're doing your dynamic warm-up correctly, you should be dripping with sweat by the time you're done. Yeah. And a perfect example of this, my brother and I,
that's why there's warm-up jerseys.
Exactly. We went to a Steelers game last year, and I won't say who won the game, but we went to a Steelers game and we were down by the field watching warm-ups. And one guy that really stuck out to me was TJ Watt, and his warm-up is insane as well. He is dripping with sweat by the time he's done. It looks like he just played the game when he's walking back into the locker room to get ready for, coming back out to actually play the game. Most of those guys, most of those linemen, same kind of thing. They are just dripping with sweat after their warm-up and during their warm-up. That should be the case with any warm-up.
Yeah.
And the other thing, I know we said we weren't going to do a Golgi tendon podcast, but as you were talking about, stretching and doing some of those things in the string cheese, it got me thinking a little bit. But the Golgi tendon organs, when we're going through a dynamic warm-up, especially a dynamic warm-up with bands, what it's doing is part of what the Golgi tendon does is tells you when you're stretched and overstretched. And so it is a protective mechanism in the tendon, the musculotendinous junction, telling the muscle not to stretch too far. And so if you are doing a dynamic warm-up, especially with bands, it is retraining those Golgi tendon organs to allow it to go through that pliability of the actual muscle. So if you're not retraining those Golgi tendon organs to notice and be comfortable with that amount of stretch prior to a game or competition, then it's going to be a protective mechanism, and the muscle will tighten up when it doesn't want to go that far. And if it's tightening up when it's not going, when you're putting it in awkward and weird positions, that's when muscles will tear. So it's a protective mechanism that you can retrain to allow it to have more extensibility and pliability, that if you're not doing it in a dynamic warm-up form, then you're setting yourself up for failure.
Yeah.
There's a science behind it.
So when it comes to dynamic warm-ups, I would also say just be very careful what you go and find. I mean, again, I talk about this a lot, is, we're in the influencer age, and you can jump on and, this person has a bunch of followers. They've got 600,000 followers. They got 2 million followers. That, they got to be trustworthy.
Sure.
Be careful, because every case is different, and so if you need any help with dynamic warm-ups or what that looks like, or want to have a conversation, either post below, get a hold of us, DM us, because there's so many different ways we can go down about this. But as we are forging the way, and our mission being protecting and building student athletes better, this has to be, because walking through Soccer Park yesterday, I'm going to go and bring up a little different part of this dynamic warm-up. Something that I'm just going to boldly say should not be included in a dynamic warm-up. We can talk some of the myths and some of the cons and some of the, I think, status quo, like this is no matter what. You carb load and you eat a bunch of pasta. You drink this, you eat this. And here's the first thing I'm going to say is, if any one of your kids, on that Life 360, like most of these kids are on Life 360, right? And it's like, okay, so they know when their kids are leaving, they know, watch them, like really, like in this area, we've got QT, right? We are the some people have Buc-ee's, QT, Sheets up in the Northeast. But whatever gas station they prefer to go to, put a ping on them somehow, whereas if they stop at QT, you get on the phone with them and being like, what are you getting? And they better say water or Body Armor Light, or do not, I better not. I'm not going to say what necessarily not to get, other than do not get a pre-workout drink. I don't want to say any brands. I don't want anybody coming after me. I used to love pre-workout when I was in college, and then figuring out what all that can do. None of you guys need to be drinking pre-workout before a game.
Mm-hmm.
The amount of bottles that have a letter and a number on them, or a little white Casper looking guy, if you know what I mean, or those are really the two top ones at this point. Time and place for those things. Nothing against those companies. I am talking about protecting and building student athletes better. You do not need pre-workout as a part of your routine, even before a workout, and definitely not before a game.
Mm-hmm.
So there's hack number one on the myth, tips, and tricks of what is now status quo that really ain't that cool.
Mm-hmm.
Kidneys, liver, respiratory rate, heart muscle, there's just so much at stake there. We can talk about other things you can do if you want a little bit of a caffeine lift, or even the blood work side of things. What do you need in your diet? What minerals and supplements and vitamins are missing in your body? It's not in a can or a little bottle that you're going to throw back before the game. Yeah. Don't do it.
That was strike one I saw yesterday. There was a little can on the sidelines that I was like, oh, okay. Yeah. So that's what he's talking about. Strike one is not that.
Strike two.
Here's strike two. Bigger strike.
Strike two. Ibuprofen, Advil, Aleve, Tylenol is not a part of a pregame ritual. It is not a preventative mechanism. And you can hear me getting more intense because it kills me to see it. We literally walked by a 16U team yesterday, and this kid just picks up this Costco-sized bottle of Advil out of this kid's bag. And he goes, these are 500s. Like, how many do you take? And he was like 1,500 before a game. I'm like, are you kidding me? Yeah. Like, okay, let's thin the blood. First of all, let's thin the blood. So now let's carry less oxygen throughout the body. Let's thin the blood. Heaven forbid, with all of this, especially during soccer, cardiorespiratory system in a lot of the sports, but especially soccer, like it's like cross country with a ball at your feet. And you're just run. And now, so cardiorespiratory system, and we're thinning blood. We're changing how the rate that we carry oxygen, but also too, it's like, what about the digestive tract? It is the most harmful in the digestive tract, the leading cause of gastric ulcers. Mm-hmm. And now, heaven forbid, you take a shot with an elbow, or you just overexert and the body goes, we're done. And you have some sort of, intestinal or injury where it causes some sort of intestinal bleed, or like a spleen's not uncommon. You get, it's like, oh man. And then your spleen ruptures. Yeah. It's like, there's just so much, but even like if they are sore, it's not a lack of Advil problem. Yeah. That is telling you that there's a lack of warm-up, there's a lack of recovery, there could be pending injury. It is not, oh, take this. You're going to do yourself more harm. I'm just going to say that right now. Yeah. Time and place for those things. I am not a huge medication guy. I will say there's a time and place for those things, but simply put, it's not a pregame routine. The amount of dancers, my daughter's almost 4 years old now. We see a lot of dancers in here, and I get it. So don't think I'm calling you out like, you bad parent, you bad coach. I'm not, because a lot of people just don't know. They don't see it that way. It's like, I don't want them in pain and I don't know what else to do. Well, we can help you figure that out. But the amount of even younger, 10, 11, 12, or maybe these little girls are on their cycle, or, maybe somebody's coming off an injury, or they're prone to headaches. It's not a lack of Tylenol problem, because here's the next thing too, is those kids are like, well, this is what I take, and they hear their friend has it. Mm-hmm. Well, here, my mom gave me these, you take, and it's a noble gesture, but you could be giving something to somebody that they don't know that they can't have, right? Or they just don't need to have it. It's not their place. It's not their time. It's not their space. And they could be allergic to it, but really the harmful effects internally that happen because of that, just know, if you guys need help figuring out, well, then what do we do? Please reach out, because I think it's costing more athletes than they know. And they're just popping it like, this is just what we do. Yeah.
The other thing that those are doing, where my mind goes, is you're covering up pain signals or soreness that is there for a reason. And one, we have to know what that reason is. Like you said, is it overtraining? Are they dealing with an injury? And then they're playing through it, and they're taking this so that they can play through it. Yeah. What is that setting themselves up for in the game, after the game? More injuries down the road, something more catastrophic. So address the underlying issue, and that's what we're trying to do here.
Mm-hmm. And I mean, and that kind of goes along with a lot of the dynamic warm up. And if there's need for taking those things, or they're having these kinds of feelings and sensations, that means there's something on the front end and something also on the recovery on the back end that's not happening properly. Or Third thing is there is an alarm going off saying there is something else going on here. Why am I getting headaches so quickly into the game?
Right.
Are we moving enough oxygen? Okay, well, what are we eating and drinking? Are we properly hydrated? What minerals are missing? What is there anything there? Okay, well, that's not it. What does a cervical spine look like? 80% of headaches are cervicogenic in nature. So why it's not figuring those things out. Why does the ankle hurt? Why do I have shin splints? The things that you're going to take are not going to prevent the shin splints. And I bet if you asked a lot of these athletes where it's like, did you feel it during the game? No, I didn't. Chances are that was adrenaline. It had nothing to do with acetaminophen or ibuprofen.
Right.
And so what we think and what we've learned and what we've been conditioned on is a practice of take this, pain goes away. Might be true in an athletic standpoint. There is so many hormones going through the body and fight or flight going on that it's probably more of that. Like, you might as well just start playing, because it's not repairing shin splints. It's not repairing the laxity in the ankles. It's not fixing the split in the meniscus. It's not fixing the AC joint inflammation you have. It's not. You got to get after the root cause. So if we're sucking down ibuprofen and NSAIDs, the over-the-counter NSAIDs, then let that be an alarm of, hey, bro, we got to do something different. Like, I can't keep giving you these, and please don't give these to your friends. Let's figure out what the problem is.
Yeah. On the NSAIDs, it's prolonging the process, and we've gone through this, but just a short little tidbit. When you're suppressing inflammation is there for a reason, and it's trying to get to the next cycle into like tissue proliferation, tissue healing. So if you're constantly shutting that cycle down, it's prolonging your healing cycle and the healing process. So you're going to be dealing with whatever you're dealing with longer. So just constantly taking that to manage it is not the right way.
Right. And it's the same, like, I mean, totally different route, but I'll get off of this real quick, is same with like a fever. It's the same thing. It's like, oh, give them the Tylenol, bring the fever down. It's like, no, the fever's there for a reason. Like, is it 105, 106? No, it's like 101. It's killing whatever needs to be. The temperature is that high. So don't prolong it. You take the Tylenol, you get it back down to 99 or 98.6 or whatever you feel like you want it to be. But whatever's in there that was trying to get burned out, and now you're just prolonging it, just like an injury. You're just prolonging the effects that it could have and altering the healing process.
Yeah, definitely.
So dynamic warm-up, a couple of things of definitely what not to do. We wanted this to be a quick hitter and foundational on just that, is, if nothing else, and have we given a bunch of tangible things you can do? We haven't, but there's a reason for that. And maybe we can do a part 2 about, okay, here's the dynamic warm-ups, and here's what these do, and here's what they target, and here's what here's hip, here's knee, here's ankle, and we can roll through that. That's a whole nother year of weekends learning what exactly to do. But also what not to do and what status quo kind of is. We wanted to kind of call those things out because it matters. And if our mission is protect and build student athletes better, we've got to get the content out. But again, if you have any questions on that, ask. But the reason we're not giving those tangible things is because we don't have your athlete in front of us. We don't have you in front of us to be able to say, if we're going to put something out there, we would love to just be like, okay, video, telehealth, in-house, what do you got? What do you need? And be able to go from there. But we can give some things on, here's what this exercise is designed to do if you need it. So if somebody has a question on, how do you dynamically warm up a hip, message us. Yeah, we can send some stuff back and get it to you.
One last story I have is that one of our athletes came up to me the other day, and this is the first step, is getting them to realize and understand and value that they actually need something specific for them. Yeah. And so she came up to me and said, hey, college is right around the corner, and here's the general workout and things that we're doing. Can you help me tailor a dynamic warm-up for me based on knowing what my history is and knowing what I need? And I was like, thank you, first of all, for coming to me and asking that question. And absolutely, I will design a program for you specifically so that you can take it to college and do it prior to games and incorporate it into your regular workout.
Yeah.
So 5 stars to her.
On weekends like this, where there is a lot of games, some of these teams, like we're going to have a team come in tomorrow night for more of a recovery session. We've got a team coming Thursday night. The dynamic warm-up, especially at these times when you're playing 6 games in 8 days, or you got a long stretch of, a few weeks of, tournament sport, whether it's baseball, it doesn't matter what sport it is. We all approach the end of the season where there's those tournaments where it's like, okay, it's state cup time. You're like, this is it. This is what we played all year for. And all of a sudden you can play a dozen games in a little over 2 weeks pretty quick, if not double headers every day. That dynamic warm-up literally starts like 48 hours before, honestly. Like if you really want to look at injury prevention and performance on that kind of demanding schedule, it starts 48 hours before. It starts with what you put down your gullet, whether you're drinking it, or what do you put on your fork. You cannot, like the one thing that'll kick your ass every time, bar none, is your fork and whatever you put in your mouth. Whatever apparatus is putting things into your mouth, you can't beat it. If you want to drink soda, if you want to drink all the pre-workout and high caffeinated drinks, if you want to eat all the carbs and little protein and you just eat snack sticks and only suck down supplements, it's going to cost you. It will cost you, and you cannot beat that. So that warm up for especially this time for you coaches and parents and even you athletes, it really does start 24 to 40 hours beforehand.
Mm-hmm. The consistency of it is key.
So show up to the field, take the 7 to 10 minutes to do a dynamic warm up. Ideally, that's designed for you. Keep the NSAIDs in the bag. You parents, hang on to those. Put them in your own bag. I know it seems like it's easier if you need some alternatives to that, but keep those things in your own bag because you don't know who else's kid's going to dig into that bag thinking, oh, the best player on my team takes it and I'm kind of buddies with him. Maybe I'll do what he does. And, protect them against that, honor that, and
replace it with a band.
Yeah. And reach out and ask more questions, and we can give you some more answers on that. So,
cool.
Anything else? No. Sam's quiet. We got Brandon in the background over here too. He's taking it all in. Starting to have a crowd. It's like we're doing it live.
Yeah,
this is nice. So, all right. Well, next week we're kind of coming off the top during this season of podcasting. So maybe we'll do part 2 on the dynamic warm up. We will see. So stay tuned next week as we jump into more information for student athletes and their parents trying to keep up. Follow us on the socials and let's continue to protect and build athletes better.
Got it.
Have a great week. See ya.